Research has shown in 2010 and 11 that 271,000 visits to emergency room departments across this province could have been treated in other settings.
In January of 2016, we started a pilot project that was supported by Council. The pilot project started with a response unit, so a paramedic unit that does not transport patients. It simply responds to calls. So we thought there's other things we could do with these paramedics when they're not responding to 911 calls. Let's see if we can launch a home visit program for chronic disease patients. Chronic disease patients, there's 3 different types of patients. They're heart failure patients, they're lung disease patients, and they're diabetic patients.
So patients with chronic diseases, and specifically COPD or CHF, or diabetes in this case, are all patients usually on multiple medications. They have multiple visits to physicians, unfortunately end up in the emergency department or being admitted to the hospital on a regular basis. I think our early response has shown that the patients, there are fewer visits to their family physician. And so for the patients, that's because they have another option. But they're still receiving care and we're still part of the team. And I think that's one of the biggest things from a physician perspective is there's lots of opportunities for people to receive care throughout the community. But the communication and being part of the same team doesn't always take place. And that's where this has a real benefit.
The benefits of the program have been both for the community with the improvement in high priority response time, and the benefits of the home visit program is that the patients are very comfortable and are feeling very supported in their home.
When I first became ill with COPD, I was very stressed over it. Like, when you can't breathe very good, it's very hard on you, and you don't really care if you even make it the next day because you just feel that bad. Prior to this program, I would have to go to the Soldiers Memorial, or if I could get my doctor, I would go and see him in his office. And but now I don't have to worry about those kind of things, lining up, waiting for hours to see a doctor. And I know, as I say, when I'm getting sick, and I get just a phone call, and you're here within 20 minutes. It's amazing. It really is.
Well, I'm becoming a primary caregiver because the last couple of years, Linda, her health has really declined. The most important thing is that when she gets sick, it's rushed to the hospital, and she's uptight. She's not feeling well. Of course, you're going to the hospital, and there's 50 people, and they're all sick, and then she has to wait. And then a doctor who doesn't know her may prescribe some drugs that may not be familiar to her. They're doing their job. However, since this program has started, it's been much better. So it makes me feel better that I don't have to worry about her at the hospital. I know somebody's going to come look after her. So really, when she feels better, it makes a lot less for me to worry about. So it does really take the load off this caregiver.
And after Kieran's visit, the next day he phoned me to see how I was feeling. I couldn't believe that he took the time out to do that.
But this is a program that has more than just surface value. When you have people come to a person's home, such for Linda here, it's so much the stress level, the care level. It's so much more than a dollar value. And when you put it all down, this is the cheapest route, and it's the best route for the patient. They're comfortable at home. This is the best thing. If you were in that position, what would you rather be doing? Having the paramedics come to you or lining up for 4 hours in the hospital?
I would love to see that everybody has the opportunity to get on this program, because it is far better than lining up at a hospital. And I must be easier on the healthcare system too.
It certainly is a good program for everybody.
It's been really beneficial because I found that I'm able to have really good relationships and I think what I mean by that is I develop relationships, I see what happens, but the biggest one is I get to see the result, and I get to come back and see the benefit of what I'm doing over and over again.
Based on the early results, we certainly hope that the program can continue and that it can expand, involve more patients and different physicians. And we've had interest from other physicians now that the program started to roll out to have their patients enrolled, because they're starting to see the benefits and see where the program can really have a good effect.
We need to think about how we can deliver services in new and innovative ways. The time for change in healthcare service is now.